Kaya dapat babuhin po natin yung ano. Dapat may seal, ma'am. Oo. Yung may seal po talaga. Oo. Kasi pag wala na, alag siya. Ano po siya mga after 6 months.
Okay, so we are back here on the number 10. What is the answer for this blank? Blank is the device to measure blood sugar or blood blank. What is the answer for this? Silubela.
Glucometer, ma'am.
And the second blank?
Sugar test, monitoring.
Okay. So what is the answer, Maricar?
Same po kami, ma'am.
Ha?
Same po.
Glucometer and?
Blood test or blood test monitoring.
Okay, what about Tony? What is your answer, Tony?
Glucometer
And
or blood sugar measure for the blood or glucose.
glucose. So what about Jennifer?
Glucometer po din glucose.
Glucometer and glucose. Okay. So the right answer is you have to analyze or you have to check your question. The question is, what is the device to measure blood sugar or blood glucose? I'm talking, or the question is about blood sugar or
blood glucose.
Okay, glucometer is a device to measure blood sugar or blood glucose. Okay, so the answer is glucometer and blood glucose. Let us here, what is the device at the end? It is blood sugar or blood glucose. Okay, so this is our medication management with the diabetic management. So please make sure that you have remember this. You have to remember. Okay, so let's go to our lesson for today.
Number 7. Ay, yung battery mo. Ay, battery mo.
Hi. Magsagit na Magsagit lang. Battery. Oh my God. Ayun na, ma'am. Battery naman.
Okay. Okay, so let's start with our lesson for today. Today, we are going to talk about
making.
Okay, so you can see here how the nursing is doing the bed. So what we need to learn for today, the objectives are the introduction to bed making, definitions, principles, purposes, guidelines, principles of body mechanics, types of beds, types of linens and equipment needed for bed making, description of beds and procedures for bed making, and equipment used for bed making. So going forward, we just want to know what bed making is. Bed making is a nursing
A
art.
nursing art.
Okay, so remember that we are under the nurses and the nursing law. So bed making is a nursing art. It is a way of preparing the appropriate bed based on the condition of the patient, which adapts scientific principles of nursing. So we are going to make a bed according to a specific condition of the patient, what the patient requires of during the time that the patient is admitted in the hospital. So skillful bed making, it promotes comfort for the patient, and nurses or nursing aides need to be able to prepare hospital beds in different ways for specific purposes. So in most instances, beds are made after a client receives certain care and when beds are unoccupied. Unoccupied means it's still open. We are waiting for a patient to come in. At times, nurses needs to make an occupied bed or prepare a bed for a client who is having surgery or anesthetic, post-operative, or surgical bed. So bed making, again, it is defined as a process of making neat and clean beds for the patient in a healthcare facility. It is the technique of preparing different types of bed in making a patient comfortable or her position suitable for a particular condition. And bed making is a nursing art. And one of the most important nursing or nursing aid techniques to prepare various types of bed for patients. So what are the principles? When we say the principles, what we need to think before doing our bed making? Number one is microorganisms are found everywhere on the skin, on the articles used by the patients and in the environment. So the nursing aides take care to prevent the transfer of microorganisms from the source to the host by direct or indirect contact or prevent the multiplications of microorganisms. So one principle is we need to keep our bed linens, the linens that we are going to use for bed making, to be away or free from microorganisms. Okay, so we have to prevent the infection coming into our patients during the time of their admission. A safe and comfortable bed will ensure rest, sleep, and prevent several complications for bedridden patients, such as bed sore or foot drop. So we have to prevent bed sore and foot drop by making a bed that is comfortable for the patient. Number three is good body mechanics, maintains body alignment, and prevents fatigue. So when we make bed for the patient, we have to keep in mind that we need to maintain our body mechanics during the time we are making the bed, and maintains body alignment and prevents fatigue. So we will not be able to feel those back pains, those back injury cause for a poor body mechanics. Systemic ways of functioning saves time, energy, and materials. While doing our bed making, doing it right saves time, energy, and materials. What are the purposes of bed making? Why we do bed making for the patient? Number one to provide the patient safe and comfortable bed to take rest and sleep. So number one is to make the patient comfortable for making them rest and sleep on the bed. So number two is to give patient a unit or ward a neat place. So once the bed making is neat enough, so we are giving a patient a comfortable place to stay, to adapt the needs of the patient and to be ready for any emergency or any critical condition or illness. So we are doing this to prevent also, or to make it ready for any emergency or any critical conditions or illnesses, to economize time, material, and effort, to prevent bed sore, and to observe the patient while on bed, to provide a clean environment, to establish an effective nursing aid-patient relationship, to provide active and passive exercises to the patient, and to help the relatives to learn care at home. So by this way, we can also provide a teaching or educating the family of your patients to learn, so how they can be able to make a bed for their patients at home. So how to do it? There are guidelines for bed making. Number one, as we learned, for all the universal standard that we have to do, number one, the first and foremost is washing of hands, hand hygiene, or hand sanitizing. Okay, so this is the number one for our universal standard procedure. Number two, we have to explain, we have to introduce to ourselves to the patient and explain to them the procedure that we are going to make. Number three is gather all required linens and accessories. Prepare, collect, arrange all those equipments, linens, accessories before you make the bed. Avoid shaking of linens to prevent the spread of microorganisms and dust particles. Roll the dirty or soiled linen while removing it from the bed. You have to remember all of these guidelines. Roll the dirty linen or soiled while removing it from the bed. Unfold them gently to inhibit the flow of microorganisms. Avoid placing clean or dirty linen in another patient's bed, and place dirty linen in the laundry or dirty hamper bag immediately. Never place them on the floor. Number 8 is to hold dirty linen away from your body. Place the open end of the pillowcase away from the door. It looks neater and helps prevent the entrance of microorganisms from the door. Always use your body mechanics, or observe body mechanics. Stay on one side of the bed until it is completely made. Observe the patient and document any observation made. Move any furniture away from the bed to provide ample working space. We have 13 to guide us in bed making. So you have to remember at least these 13 before you make the bed. Going for the body mechanics. What is a body mechanics? It is a term used to describe the ways we move as we go about our daily lives. It includes how we sit, how we stand, lift, carry, bend, lie, and sleep. So it is the movement of our body, when we are doing our daily activities. Good body mechanics may also protect your body, especially the back, from back pain and back injury. So poor body mechanics often cause of back problems. So many nurses, so many nursing aides, they have all these back problems because of not maintaining body mechanics during the bed making and some other procedures. What are the principles of body mechanics? what we need to remember, or what are the guidelines to guide us during our body mechanics, maintaining our body mechanics. Number one is to maintain good body alignment. So number two is to use the large or big muscles of the body instead of small muscles. What are the big muscle groups? They are composed of quadriceps, the chest, gluteal, back, and hamstrings, and they contribute to your body movement, while the smaller consist of triceps, biceps, shoulders, and calves. So as we maintain good body alignment, we should remember also that we have to use our big muscles, okay, while doing our bed making. Works smoothly and rhythmically. If you two, both of you, are going to prepare a bed for your patient, and both of you, you can work it smoothly and rhythmically. Not unless if you are alone, you have to do it alone. Push or pull rather than lift because it requires less effort. Using your own weight to counteract an object to decrease an effort or strain. In our positioning technique, we will be using this body mechanics, and this will guide us in counteracting a patient while transferring them. Okay, so what are the types of linens? There are types of linens that we need to use during our bed making. We have 6 of it. The blanket, it is a large piece of cloth, often soft, woolen, and it is used for warmth as a bed cover. We have top sheet. Top sheet is used to cover the patient to provide warmth, made of thick cotton. Cotton draw sheet is a piece of cloth over the rubber sheet to absorb wet to protect patients from becoming wet. Bottom sheet used to cover the bed after the mattress cover. Rubber sheet used to protect the bottom sheet from sooting due to patient's sweat or secretions and prevent the patient from getting bed sore. It's usually placed over the center of the bottom sheet. And pillow cover or pillow protectors, they are used to protect pillows from dust, mites, and stains. So they usually have a zippered closure. So the pillowcase is what you sleep on. It is placed over the pillow cover. So we have 8 types of linens that we need to use. What are the linens and equipments needed for bed making or bed? Cot means a pediatric cot, a pediatric or the baby or the infant bed. It is called a pediatric cot or infant bed, or the big bed or adult bed. Chairs and stools. We need mattresses and pillows, blankets, sheets, pillow covers, rubber sheet or draw sheet, linen trolley, and hamper bags for the soiled linen. Now, we have different types of bed, and we have 7. Number 1, we have the open bed. We call it admission bed or unoccupied bed. So we will discuss each one of that in a slide later on. Number 2 is a closed bed or occupied bed. Number 3 is aesthetic, surgical, or post-operative bed, cardiac bed, fractured bed, amputation bed, and blanket bed. Number 1 is an open bed, admission bed, or unoccupied bed. So for the open bed, we can call it admission bed, unoccupied bed. We are preparing this bed with new linens ready for newly admitted patients. So once the nurses ask you to prepare an open bed or admission bed or unoccupied bed, we are preparing the bed with the new linens ready for a newly admitted patients. So the term open bed, it is designated in the hospital bed when it is about to be occupied with a new patient. You can see the photo down. It is prepared, waiting for a new patient to be in this bed. Okay, so it is open. There is no one there, and it is ready for a patient to be newly admitted. This is open bed, admission bed, or unoccupied bed. So the equipments needed in each particular bed, we need to have an equipment appropriate for that bed. Number one, in this open bed, we have bottom sheet, draw sheet, top sheet, blanket, pillowcase, and a patient gown. The procedure, what we need to do is, of all the procedures, for all the procedures, as I said, all of those procedures as universal, we need to have hand hygiene, number one. First and foremost, we need to have hand hygiene, washing hands if hands are visibly soiled, or frequent hand sanitizing. Number two, we have to explain. We have to introduce ourselves, or we have to explain the procedure to the patients if the patients are available. Arrange the linen on chair or gather, prepare all the linens, what linen you will be requiring on a chair in a manner which is going to be used. Place the clean sheet on the mattress with lengthwise fold. This is how we are going to do it. If it is open bed and you are alone going to do it, so number three, this is how we are going to do it. So place the clean sheet. You have to imagine, you have to imagine how we are going to put the bed sheets on the bed. So place the clean sheet on the mattress with lengthwise fold at the center of the bed. So we have to put it lengthwise at the center of the bed. Remember that you are going to make the bed alone. So tuck the top sheet and under the head part and next to the foot of the bed on the side close to you, and meter the corners. How to meter the corners? Making it a neat corner. So we have to do it in our practical application. So you will know how to meter the corner. Okay, remember that we have to meter the corner of the bed. So pull and tighten draw sheet and tuck in well. So after the bottom sheet, we need to put the draw sheet. If we have the rubber sheet, we put the rubber sheet first, and over the rubber sheet, we have the draw sheet. And place top sheet over the draw sheet. Spread the blanket over the top sheet and tuck bottom top sheet and blanket together on the foot part. Fold the upper 6 inches at the top sheet and blanket down in a fan fold or pie fold. So move to the other side if you have already done the half. So you can move now to the other side of the bed and follow the same procedure from bottom to the blanket. Lastly, you put the pillowcase and place the pillow at the head end. If you are putting the pillow, you have to hold hold outside of the pillowcase, then grasping the pillow from inside. Okay? So rearrange furniture and place personal items within each easy reach. Adjust the bed to a comfortable height. So this is how we are going to prepare a simple bed, open bed, or unoccupied bed to a patient, to a newly coming patient for the ward. Number two, we have the closed bed, or we call it occupied bed. An occupied bed is the one that is made while occupied by a patient. In the photos down, you can see, the staff is making a bed alone. So how she is doing it alone. And also on the right side, while patient is sitting on the bed on a Fowler's position, we have to make a bed for the patient who is occupying a bed. So what are the purposes of occupied bed? So to provide active and passive exercise to our patient, means to say when patient is on the bed, before we prepare or we remake a bed or we have to make a bed for the patient, we have to make an active exercises for the patient. Active means to say we are asking or supporting or assisting the patient for their active exercises. Secondly, if we are providing them a passive exercises, so we need to follow what our physiotherapist doing. So when the patient is on the bed, we have to support or assist or give the patient passive exercises while on the bed to promote cleanliness, to establish effective nurse-client relationship, to prevent bed sores. Once the bed is made, so it prevents bed sore because of this the crumpled bed sheets can be a factor in having bed sores for the patient. So make it sure that the bed sheets are wrinkled free. To observe the clients, example for the bed sore, during the time of oral hygiene, the client's ability for self-case. If they will be able to help themselves, you can just assist them. To economize time, materials, and effort, and to provide the clients with safe and comfortable bed to take rest and sleep. So what are the articles we need or the equipments we need to prepare for the occupied bed? We need top sheet, blanket, pillowcase, bottom sheet, draw sheet, and the patient gown. Before preparing or arranging all of these equipments that you will need, better to assess what the patient needs. Like, for example, if the patient had vomitus and the patient had passed urine on the bed, so we need to assess what do you need, what preparation or what equipment do you need before you change the patient's bed. What is the procedure? The same thing as I told you, generally or in universal procedure, all you need to do first and foremost is to wash your hands. Wash your hands visibly soiled only. So if you require to wear gloves, it's fine, because just to assess whether you will be needing a PPE. So identify the patient, explain the procedure, and be sure you will have the patient's cooperation. Some of the patients, they don't want to move from their bed if they are lying down or if they are occupying the bed. So you have to convince, explain to the patient the procedure that you're going to do. So be sure you will have the patient's cooperation. So check the condition of the bed linens to determine which supplies you will need. Provide for the patient's privacy throughout the procedure and obtain the articles of linen that you will need, and assemble the equipment and arrange the linen within easy reach. Loosen the beddings on all sides and remove the spread and the blanket, leaving the top sheet over the client. Fan fold the draw sheet to the clients and push it as close to the client as possible. Dust the mattress with a dry duster. Nowadays, we have the antimicrobial wipes that we can use it. So then by raising the mattress, clean the cot with a damp duster. So as I said, we have already nowadays, as a modern time, we have the Kabi wipes. You remember in our infection control, we are going to use those Kabi wipes instead. So place the clean bottom sheet over the mattress, making sure that the middle fold is in the middle of the bed. So bringing draw sheet back into the place and tuck it tightly up under the mattress. Turn the client back over the folded linen, and then towards you, go to the opposite side of the bed. If you are alone, this is how you are going to do it. But if you are two, it will be easy for you because the same time, you can both do it. Number 13, remove the soiled linen and put them immediately in the dirty laundry hamper bag. Turn the client back to the middle of the bed. Place a clean top sheet over the client and remove the soiled top sheet. Replace the blanket and spread over the top sheet and make the bed as an open bed. Tuck the foot and giving enough freedom for movement. Place a footboard or cradle at the foot of the bed. So right now, if you are just imagining what we are doing in this procedure, you can imagine how we are doing it in a practical. Okay, so once we do it in a practical way, you will be knowing it soon. We will do it. Okay, so put the clean pillow always. It is the pillow and the pillowcase will be the last. And place the pillow in the position and leave the client comfortable. Number 3, we have anesthetic, surgical, or post-operative bed. This bed is prepared to receive a patient from operating room and is recovering from the effects of anesthesia following a surgical operation. So you can see the post-op bed down below. So there is like a triangle flip or a fan fold open. It is ready for accepting or receiving a patient from the operating room. So what is the purpose for this bed? So to receive the patient in a warm and comfortable bed, to give him necessary position which is suitable for the operation, to protect the patient from being chilled because those patients coming from operating room are being chilled or feeling cold. So to be prepared to meet any emergency because we don't know whether the patient will be stabilized or will be stable soon after surgery, and be prepared to meet any emergency. To protect the mattress and bedding from bleeding, vomiting, drainage, or discharges. So what are the articles and equipments we need? We need a large sheet, draw sheets, blanket, pillows, pillowcases, towels. Check if the drainage is anticipated. We have to check whether the patient coming from operating room has drainage, they have lines, and we have to prepare suction, oxygen cylinder, and we need to prepare also the vital signs tray, hot water bags for cover, the IV stand, kidney basin, and some paper towels. Procedure, the same way as we have with the closed bed, but this one, simple bed. What I mean simple bed, so we will be needing more of the underpads. Now we have the underpads, but in the normal conservative beds, we have a draw sheet. So prepare for those draw sheet or the underpads. The foot end of the top linen are left untucked. Did you see the linen? It is folded on a triangle or a fan fold. That is how we are going to prepare the bed before receiving a patient from operating room. Post-anesthetic tray, the bed blocks, IV stand, all of those will be ready. The pillow is used to protect the patient from injury. We can put it on over his head, and the foot also, we have to put also the footboard. Hot water bags and to make the patient warm, and lock the brakes on the bed and move the furniture away from the bed to allow for easier access to the bed for the recovery. For the recovery room stretcher to come in near to the bed. Number 4, we have the cardiac bed. Cardiac bed, we prepare it for those patients who have heart cases. So just like in what you see in the photo below, in the right side, you can see a cardiac table. We call it as the food tray, the food table. why we need the food table. We will come to know what is the purpose of this one as we prepare it for a cardiac bed. So what are the purposes? Number one is to relieve dyspnea caused by cardiac diseases, or dyspnea is a medical term which means difficulty of breathing. Dyspnea is difficulty of breathing. So to relieve patients from dyspnea, why we need this cardiac table or why we need this food table? So they are most of patients with heart disease, they cannot sleep lying flat on bed. So they preferred to sleep sitting on a Fowler's position with their head bowed down over the food table or the cardiac table as we call it, to provide comfort with less strain and to prevent complications. What are the equipments and articles we need? Bed sheets, draw sheets, pillowcase, patient gown, cardiac table or the food table tray, the backrest, footrest, and air cushion. So remember that in cardiac bed, we need to prepare the food table tray or the cardiac table as we called it. Procedure is we need to prepare the bed as open with footrest at the foot of the bed, with backrest at the back of the patient, and arrange pillows in comfortable position. Keep the patient in bed and cover properly. Adjust the air cushion in place. Place the knee pillow under the knees to prevent sleeping of the patients. Nowadays, the new beds, the modern beds, we don't need to put pillowcases or pillows under the patient knees, since the new beds nowadays, the modern beds, we have like automatic on the under the knees that you can fold it. So place the cardiac table in front of the patient with the pillow on it so that the patient may lean forward to rest his head and arms on it. So this is the purpose why we need the cardiac table for the patient's bed, for the patients who are having a cardiac case or heart case. Make the patient comfortable. Number 5, we have fracture bed. Fracture bed, we called it as we prepare for a patient with fractures of the trunk and extremities. So a hard firm board is used to give support. You can see down here in the photo, fracture bed. So these beds, we are using it for those patients with fracture, the broken bones on the trunk and the extremities. So there is a hard firm board which is used to give support at the back of the mattress. We are putting it under the mattress for the support of the back and trunk of those patients with a fracture. What are the purposes of this fracture bed? To give firm, even support to the fractured limbs and back, to maintain position, to immobilize, not to move the fractured side so that the pain is less, and to make the patient comfortable. What equipments and articles we need? We need bed sheet, draw sheets, top sheets, blankets, pillowcase, patient gown, fracture board, sandbags with cover, and bed cradle. You see, in different beds that we prepared, there are different equipments appropriate to prepare that certain bed. Okay, for this fracture bed, we need fracture board, sandbags with cover, and a bed cradle. So how to do the procedure? We place the fracture board directly over the bed springs, then a thin, firm mattress or pad over the fracture board, and the bed is prepared as simple, just like the oaken bed for those admission patients. Number 6, we have amputation bed. Amputation bed is prepared for a patient with amputation of the leg to take off the weight of the bed, clothes off, site of the operation. So amputation bed means it is used for those patients